Hello ladies and gentlemen, this is Dr. Haris, and in this video we'll talk about the various myths and facts about teething. The purpose of this video is to educate the parents and rule out the myths that are associated with teething. Now, first of all, we should never confuse any major disease or disorder with tooth eruption. Sometimes the baby requires immediate medical attention, but the people or the parents think that this is attributed to the fact that the teeth are erupting. Okay, this video we will also discuss about all the things which are to be expected when the teeth are erupting. So let's first of all talk about the myths. Now there are some people who claim that when the teeth are erupting, the child develops a rash on his face. Now, there is no scientific evidence about this fact, and this is totally wrong. What happens is that when a baby is in the teething age, that is around 6 to 8 months, the immunity of the baby starts to develop, and the immunity which was transferred from the mother to the baby starts to diminish. Therefore, the baby is prone to infections. And in this age, many people kiss the baby on the cheeks and on the lips, and their saliva is a source of herpetic infection. And this explains the cause of the rash. So it's important that we do not confuse rash with tooth eruption. Secondly, some people claim that diarrhea and vomiting is closely associated with teething. Now this is absolutely wrong. When a baby is in the teeth erupting age, the baby also starts to crawl. And in the crawling adventures, anything that the baby encounters, he'll pick it up and put it inside his mouth. Now this is a source of a gastrointestinal infection or a stomach infection, and this explains the diarrhea and vomiting. And this has to be taken very seriously. This requires the attention of a doctor. Some people also claim that when the teeth are erupting, the baby will have severe fever. This is absolutely wrong. We have to find out the reason, the underlying cause of the fever. General weakness has nothing to do with tooth eruption. Muscle stiffness and epileptic fits have no connection at all with tooth eruption, and they require immediate attention of the doctors. So what are the things that are to be expected when the teeth are erupting? When the teeth erupt, there are some chemicals which are released, and they sensitize or they irritate the nerves that are inside the gums or the jaws of the baby. Therefore, mild discomfort and tenderness in the area can be expected. Even mild fever in some cases is said to be normal. But there's no need to create a fuss about it, okay? You can control these situations, and what we can do is that you should always use cold or frozen fruits and vegetables. Okay, this is the non-pharmacological management, and in this management, we advise the parents to use frozen banana or frozen peeled cucumber and give it to the baby to eat, and this will provide relief to the baby. Secondly, it's very important that whenever a baby has taken his feed, the mouth inside should be cleaned, and it should be cleaned very gently with a wet gauze or a wet finger. And it is also seen that the saliva is drooling on the circumoral area, the area around the lips, or even it is wet with milk. So the area around the lips and the area around the mouth should be kept dry and clean at all times so that the baby does not acquire any sort of skin infection. So this was all about the myths and facts of teething. I hope you found this video useful, and if you found it useful, please give a thumbs up and do not forget to subscribe to my channel. This is Dr. Haris. Thank you very much.